Hello, I'm Lisa Tyler. I'm the host of Senior Connections, and this is the television show that focuses on older adults, and it's brought to you by Senior Resources, your area agency on aging, serving Muskegon, Oceana, and Ottawa counties. And we come together every month to share information about programs and resources for older adults and their caregivers. We cover things from Medicare to prescription benefits to in-home services to just general fun programs out in the community, and we hope that you find that information valuable. It's May, it's Older Americans Month, and so there's no better person to have on the show with me than the CEO and my boss, Pam Curtis from Senior Resources. Welcome, Pam.
Oh, thank you for having me.
It's nice to have you back. It's been a few years from when I was looking back on our scripts. But so Older Americans Month is the one month that the whole country comes together and celebrates and talks about older Americans. We do it all the time. And as I've said before, I think that the pandemic has been one of the bright spots, and there are a few in there, is that we focus and have been talking about older adults a lot more in the last 14 months, which from our perspective is always a good thing. And we'll talk a lot more about that. But before we get into all things older adults, let's hear a little bit about Pam Curtis and your world working in this area.
Oh gosh, I've been with Senior Resources for 31 years. Worked my way up through the organization. There were 7 staff when I started, and we were downtown in the Torrent House. And now we're over at Tanglewood Park with a stop in between on Sherman Boulevard, and we're over at Tanglewood Park with 109 staff. And just an incredible amount of growth. The number of programs that we've added, it's incredible.
How long have you been CEO?
I've been CEO since 2009.
Okay.
I started out as a program manager managing contracts, and then I was the community services director and did the area planning and program development. And I was associate director for a year before my predecessor left, and then I became CEO.
Wonderful. Well, so you know all kinds of things about it. So 7 people, is there anybody, so you are the only person left from that 7-person staff?
No, there's still one other staff person
Mary
left, Mary Austin,
okay,
yes.
so 2 of you. We did until about, I think almost 2 years ago, have a 3rd person because
Yes.
Sherry was part of that.
Yeah, and
so.
Mary actually has been there longer than I have.
She's
so.
been 35 years?
I think it is, yeah.
It's really an amazing thing at Senior Resources, and we could do a whole thing about the longevity of the team there. People come and they stay a long time.
Oh, if you told me, I'd be there 31 years later, you figure when you're young, like I was a child, a junior high prodigy is what I tell everybody. And so when I was young, I thought, 5 years, but this work is interesting every single year. It's different. There's always something you can be doing more, different, better. And so I've never been bored. And I think the day that I'm bored is the day that it's time to find a new job. So.
Well, and even with your 31-year history there, nothing could have prepared you for what the last 14 months have been like, this pandemic. I mean, nothing could prepare any of us. I remember early on my daughter, who's 20, saying, "Mom, have you ever lived through anything like this?" And I said, "Oh no." We've lived through, 9/11, and I was a baby when JFK was shot. So of course that has no memory to me. But there have been really seminal things. I remember, the space shuttle explosion and those kind of things. But those were defined. There was a 9/11, there's been repercussions that, we still feel. But this is crazy. Yes. I mean, it's just insane. Life-changing, I guess, is the better way to say it. But we're still going. We have, even though we're working remotely, and we have... before everything shut down, we really moved the rest of our staff home. We've always had some people who've worked home. We've continued without missing a beat. Yes. So let's spend some time talking about some of that, how we transition to continue to serve our participants, and then maybe a little bit about how some of those things have changed. So we've been working remotely, so talk a little bit about how that has gone.
Well, fortunately, we were already in a good place to work remotely because we had some of our staff working from home. So our infrastructure was set up that we could move home. And everybody, right down to the receptionist, was able to move home and work out of their home. And she's still answering phones out of her home today, which is pretty miraculous. The state put some orders in place about not being able to go into home and do home visits. So our nurses and social workers had to adjust how they were seeing our participants. And it's really not the same talking to somebody on the phone as it is seeing in person and seeing what's going on in the home. And, you just pick up on different things. And
Just the cleanliness, whether there's food in the refrigerator, whether
They're taking their meds.
Right.
Yeah.
To lay eyes on somebody is really, really important.
So that's been really hard. We have been dabbling into telehealth, where we put a tablet in the home and then the supports coordinator can talk to the person. Not everybody's comfortable with technology, but we're working on it. But really just that constant contact, especially when we first came home, people were being contacted, our participants were being contacted on a regular basis. We're talking to them weekly just to make sure everybody had food, they had access to the medical care that they needed, that their home services were coming in if the services were a priority for them. And so it was that constant contact. And then as things went on and things stabilized, then we were able to kind of back off that a little bit. But we're still minimum monthly contacts, and some of them more than that.
And not everybody wanted or was comfortable with those home services still coming
Right.
in, right? So we've had a lot of issues with that. I mean, there's a direct care worker shortage. I think almost everybody is aware of that. That's been in the news a lot. That's something we've been very involved in advocating for. But a lot of times people weren't comfortable with having somebody come in early on when things were really so unknown.
Well, you're talking about the most vulnerable population during COVID was the older adults, and having somebody coming in and out of your home that might be coming in and out of more than one home, put people at greater risk. So it was understanding that people might not want that home care worker. Families stepped up in some cases, and I think we can be reasonably sure that some people probably suffered some consequences as a result of not having their services in. But we did as best we could, and we tried to listen to them and what they wanted and what they were comfortable with. That was priority number one.
Yeah. It ended up being very fortuitous that we had, as an organization, thought to put into place a full-time caregiver support specialist just a matter of months before that Virginia moved into that role full-time, and we had her on the show last year. But because the caregiving for family and friends really had to step up, because it's so important to us to keep people in their own homes and for as long as possible, but lots of people needed lots of help. And so I know that Virginia has been very, very busy with, again, trying to navigate doing things in person, but doing lots and lots of phone calls to try to help wherever we can.
Yeah, we really did two programs that started in the fall of 2019 that ended up being very beneficial during COVID, the caregiver support position as well as the telephone reassurance program for people that are isolated. We knew isolation was a problem before COVID, and then it became very apparent during COVID. So right place at the right time. It was not always easy to gear programs up when you've got a pandemic going on, but at least we already had them in place. And, I think that created some success there.
Absolutely, and we did have Call 211 on last year too to talk about that and how, literally that was a lifesaver, I think, to some people, a real lifeline for people. We also did a lot of work with our partner organizations through getting them personal protective equipment and doing food out in extra funding and things. Talk a little bit about how, because that's what I think a lot of people don't realize. They might know us for, our options counselor, certainly, which is always one of the last things I, remind of that phone number. And they understand us for our programs, but maybe not the connection we have with this really vital provider network.
Yeah, so we have this, I refer to them constantly as the aging network, and it is over 100 providers in Muskegon, Ottawa, and Oceana counties, which is the area that we serve, and they have been incredible. The bulk of those providers are in-home care agencies, but then we have our senior centers, and they have all stepped up in incredible ways during COVID, whether it was getting food boxes out. We partnered with United Way to do a shopping program for people that were afraid to go into the stores. In Muskegon County, we worked with MoCap and the Veggie Van and Mission for Area People and Salvation Army and AgeWell to make sure that people were getting fed. People just stepped up, and we developed new partnerships. I think that was probably one of the highlights of COVID, was the new partnerships. Organizations we were familiar with, but maybe hadn't partnered with formally. Doing produce boxes. That's not our area of expertise, but the state told us we could have produce boxes, and so we developed partnerships and we got produce boxes out to people last summer, and very well received.
We really had to do a lot of things on the fly because we were fortunate. Funding was coming, from the federal government down through the states and then coming out, but it was coming out quickly with not always a lot of direction on how to do it. Here, we're going to give you this food, and now figure out quickly how you're going to get that out to the people you need to.
So we appreciate the thought behind it, but it created its own set of chaos. But good comes from chaos as well.
Right,
So,
and we've been fortunate that some of the funding we've got from CARES Act and things has been allowed to last a little longer, because we talk all the time internally, there's nothing worse than putting in services and having money for things and then pulling them out when the funding goes away.
Exactly.
And so much of our funding is very specified. We really don't have a lot of funding that we get a lot of wiggle room with.
Right.
And we don't do a ton of fundraising. So, those kind of things. But we've been fortunate that they've allowed us to do that. And a lot of that funding has just gone right out. I know that we still in our office have a lot of personal protective equipment, but we were doing a lot of that early on, because you may remember, of course, that's part of the reason the mask mandate didn't come out when it did, is because there was fear that the people who really needed it wouldn't get it. So we got gloves and gowns and masks and masks and masks.
Hand sanitizer.
And hand sanitizer. We were getting them from every source we could. We were taking trips to Lansing to pick up things, or to Grand Rapids from our partners there. And
well, even when food was short, we know that Age Well Services was having trouble just procuring food at one point, and we were able to work with some of our other national partners to get some food to people, meals delivered to their home. Our staff came in and donated food so we could put food boxes together. People just, everybody just stepped up.
Drop-offs for people as needed.
So, I think we did really well considering the circumstances.
Yeah, if I was to think of one word probably to reflect on work with senior resources last year, partnership or collaboration would probably be it, because there was so much of that last year.
Well, I always say, and this, is that we can't do what we do without our community partners. Our staff is amazing, and they need those community partners.
We're not the ones actually going in the home and doing the care. We're coordinating that care. We're evaluating the need for it. We're making sure that it's given when it's supposed to and all of that, but we're not the ones doing that. We couldn't do that. It's really an amazing network of people that I didn't know about 6 years ago before I came here. So we're also doing some things to address social isolation. As you said, we've been aware of that as a concern for years. We had kind of a public awareness campaign pretty heavily on that a couple years ago. But talk a little bit about some of the new things, the tablets and One Day University, and some of the cool things we've introduced.
Well, like I said, we were fortunate to have telephone reassurance in place and gearing up when COVID started. But then we started looking at other opportunities, and some of them serious, some of them, a little more on the fun side. Not only addressing social isolation, but engaging people's brains, just to do something. So we have One Day University. It's an online platform. Professors from all over the country, all kinds of topics: history, science, politics, art. And they're usually like around a 1 hour program that people can watch. They sign up for free, and then they can watch as many or as few as they want. And then there's a live event every day. I think we're usually around 4 o'clock our time, that people can sign up for as well. And it's just, it's a way to engage your brain. We know at least one of our senior centers is using that and bringing a group of people in now that it's safe, and holding conversations around the lecture when they're finished. So that's been wonderful. We've done these things called Maria's Boxes for some of our homebound participants that has activities in them. There's a craft, and then there's some mind games, and just to keep your brain active, and word searches and those types of things. So we've been sending some of those out every month. Tablets that you mentioned, we're gearing that up right now, so that people can talk to their families, talk to their supports coordinator, see them on a screen. So there has to be some connectivity. So we will either help with the connectivity, or if somebody has access to it, we can just provide them with a tablet. I'm sure I'm missing something else, but those are I think, a couple of the more unique ones that come to mind.
Well, we can come back to some of that, but let's talk about another new program that we launched in the middle of a pandemic, Enhanced Care Services. And we've had Kim Vasquez and Laura Macklem on here before to talk about that, but I don't think we can ever talk about it too much. It's an amazing program that's basically that old-fashioned medical house call. But we were planning for it pre-pandemic, but we actually got it started late spring last year. And so talk about how that's going and why we thought it was important to do that.
Well, everybody knows health happens at home. It doesn't happen in the doctor's office. It doesn't happen in the hospital. Those are where you're dealing with things, but it's not what's going on in your home. And we do a lot of home and community-based care. We do the meals, we do some home care, those types of things. But we were realizing there was a gap for people with their health care. And the whole idea behind enhanced care was to close that gap. So really to pull a whole circle of care around somebody. And with enhanced care, we started out with it, the whole intent was to work with somebody's primary care physician and support that with our nurse practitioners. Now we're seeing with a couple of the local primary cares closing, that we are actually becoming primary care for some folks and then still doing that shared service for others. People have difficulties there was fear of going into a doctor's office or a hospital, but then there's also the difficulty of getting there, whether it's transportation, just limited mobility. And so we can go visit them in their homes, lay eyes on, what's going on in the home. They can look at the medications and somebody can show them all their medications and then start talking your way through them, to see if they're still taking them. And sometimes people don't realize that they're supposed to stop taking one medication when they start a new one, and it gives the nurse practitioners a chance to just lay eyes on and say, okay, we want you taking these. We're going to take these out of circulation, and just do they have enough food in the fridge? They'll work with our supports coordinators as well, our nurses and social workers that do the home and community-based care. So there's a partnership there, or they don't have to have that home and community-based care, and they can just have the medical care. But it's so critical. I know that the physician that oversees the program was surprised, to go out into the homes and to see how different it is than a white, sterile office, and talking through somebody. People don't always want to admit how things are really going. And
you get a much truer picture when you're in somebody's home. And they're more comfortable. There is a stress level that just, I think, happens for all of us when we go I know it happens to me when I go to the dentist, even if it's just for a cleaning, for a doctor. I mean, blood pressures actually rise. The chairs aren't comfortable. It's just something to be in your own home. And what I think is super important is they're not just 15 minutes in and out visits.
Right.
They have more time. They actually spend, especially early on when they're building up the relationship, spend a significant amount of time with the participants in those programs.
And we're not looking to compete with any of the physicians in the community. It's really to enhance and work with, or in place of, if there's somebody that's not available or a physician, there's not an option for another service to go into the home.
Right.
So I kind of want to be clear on that.
Yeah, there's a reason we call it enhanced care, because lots of our people are using this in addition to their primary provider, but we all know sometimes it takes a little while to get in, and to be able to pick up the phone and have a whole care team that could just walk you through it, or just is communicating. Some people aren't comfortable communicating with their primary care provider, but they might have more of a relationship with the support team that can be the go-between.
Well, and it was designed to fill a gap that we were seeing in the community. We were hearing from our supports coordinators, we were seeing it about people not following up after hospitalizations with doctor's visits, or not, just not being able to get there. And so, we came up with this idea, and we're running with it right now.
Yeah.
So.
Well, and who knew when we came up with it before that how timely it would be when people weren't going into their provider because of fear, and because honestly, if it was an emergency, lots of times that wasn't happening for a variety of reasons. And so it's certainly, you don't want to see people deteriorate by missing those medical visits. So I think it's been a really great program, and it's just a really great organization to be a part of. Seeing everybody out there. So, talking about the pandemic, it's pretty much certain that nothing's going to go back to where all that it was before. Some of that's good, a lot of it's good, but there's some bad. But what are the good things? What are the changes that you've seen that you'd be happy to see change, or that make you think differently about the way we do business or the way we offer services, or both?
I think the first good thing about the pandemic was just the recognition of older adults in our community, and that they're there, that they need services, that they're a viable part of the community, and that they were greatly affected by this. But created an awareness, and I think that was a good thing. For senior resources, I think the new partnerships were incredible. I see things happening in the future in different ways as a result of that. We might not be doing food boxes this summer, but something else will come up, and we already know that we can work well together, and that if we put our heads together, we can hit the ground running. I think the telehealth option is another good one. Just again, for people that have a difficulty getting out of their home, transportation, mobility issues.
Just in the winter in Michigan, realistically, that's really helpful.
So I think those are some of the good things for our staff. Some of them finding out that they can work from home and maybe do a combination of sometimes in the office and sometimes at home. Sometimes you can work more efficiently at home, less interruptions. But there's also a need to have contact and socialize and be able to turn your chair around and talk to one of your coworkers and say, hey, one of my participants is having this issue, have you ever dealt with this? And being able to talk it out. You can pick up the phone and do that, but then you have to worry about, am I bothering someone? This way you can see somebody's not on the phone and you can just turn around and ask. So, but I think there is some good that's come out of that, and it won't go back to what we considered to be normal back then. But I think we'll be in a good place once it's all
we talked earlier about the number of staff we have. We already were joking before all of this that we couldn't fit all of us into the conference room at work. We know we'll probably only have 2 times a year that we're all together, maybe 3 if we have a staff retreat, but pretty much our staff picnic and our holiday party. And other than that, we'll have to. We had to anyway with 109 people.
Have to Zoom people in.
We'll be doing that.
Well, we know that for our public hearing for our area plan, we had 30 people attend. It was virtual, so that meant we know that we did not reach some people that would normally just attend in person. But we've never had 30 people attend one of our public hearings before, so now we know we want to offer that as an option to do both. Board meetings, just meetings in general, I think. Some of them can be done in person, but if somebody's got a tight schedule and they can pop in on a Zoom call and participate, there's some efficiencies to be gained there.
Well, with us having a 3-county area, the transportation time, some of our staff doesn't live in Muskegon, even though we're headquartered in Norton Shores. We don't have as much of transportation kind of things. You were going to Lansing at least once a month for a whole day. You've managed to keep doing those a lot. I've talked to a lot of our public health director said, I don't think I'll be doing all those meetings I was doing in Lansing. We're finding efficiencies. And as long as we can get back into the participant homes at some point, I think that's the biggest part we're missing. That and just the human connection that we need to have.
We need to get back into those homes, and I think we need to tell the participants to tell us they're ready and to invite their supports coordinators back in the home. And the supports coordinators need to ask. Are you ready to have somebody in your home? And then taking the precautions necessary to make that happen. But I think everybody needs that contact.
Well, I just heard that Adult Protective Services is able to go in the homes now. They finally, because we take our guidelines from, our funding sources, the state and federal, the state level, where they say whether we can or can't do some of that. But when I heard Adult Protective Services, which was a huge, to me, to keep adults safe, that was a really, really important thing to do. So. But let's talk a little bit about Older Americans Month now, because it has a focus every year, and this year's is Communities of Strength. So what does that mean to you?
I think Communities of Strength is exactly what we saw during COVID. It was people stepping up to do what was needed at the right time and the right place. And I think that's just going to continue. I think we can build on that. Communities of Strength is our aging network, making sure that older adults have the services they need in their home. It's the partnerships that we develop that aren't the norm with the Love Incs. And the Mission for Area People and MOCAP, and being able to continue those types of relationships and build on them, or just circle back to them when needed. We might not need to do anything for quite a few months, and then all of a sudden something will come up, but we know we've got people that we can reach out to. And so I think that's really critical. Our partnerships with the United Ways, the community, this whole thing has, I think, created community, even though we've all been isolated. I think it's just created an awareness and what's important
And I think it's a two-way. We know who to reach out to, but I think they know to reach out to us as well, because we always say we're kind of that best kept secret. You don't know us until you need us is kind of our unofficial tagline. And it's unfortunate as the communications director. I'm always like, no, you need to. But that's one of the things I say when I used to be able to do speeches. If you just remember the name so that when you need us. But I've had people reach out in organizations, reach out to ask. And it is, it's sometimes just something small, and sometimes it's just something on Facebook, somebody asking me because they know where I work and because we're having more attention paid. But I think we're also having a lot more conversations about the value of older adults. And like you said, that to me is the number one thing to come out of the pandemic, was that we talked about how important it was that we all rally to try to protect our most vulnerable. And yes, they're not the only vulnerable ones, but when it came to this is the biggest focus I remember on older adults that we've had.
And I think just our ability to reach out and say, we have transportation money, can we help you get people vaccinated? Or, we've got access to food, are you getting everything that you need? We have ability, as an area agency on aging, we have that ability because we're a program and planning organization first and foremost before we do everything else. So having that in place and having some funding available and just being able to say that we can help, I think is important. And spending that money, those are taxpayer dollars,
right,
and spending them efficiently, effectively, and smartly, just with a lot of thought behind it. So, my hope is that some of this new money that's been coming in can be extended over a couple of years so that we can make services last for a few years, right, instead of going over a cliff and having to cut everybody off at some point.
Right.
So.
Yeah, it's one thing to say something short term, maybe, we can do this for 6 months or something, but we don't want to put something in that somebody comes to rely on and then pull the rug out from under them, because there's nothing worse than that. So, well, we've got about 2 minutes left. I know we just had a meeting just a couple of days ago about the Senior Advocates Coalition. It was our first one in 14 months. So talk real briefly about, we can't talk about that. We can do advocacy a whole long time, but we did get to share some updates with our state lawmakers and hear some things from them as well.
Yeah, we were able to talk these are our local legislators, our state representatives and state senators. I'm just able to talk about the Older Michiganians Day platform, about looking at long-term care and advancing long-term care so that there's more dollars available for people wanting to remain at home, which is about 90% of the older adult population. Right now, we put more money into nursing home care than we do to home and community-based care, and not that there's anything wrong with nursing homes. They certainly have their place, but most people want to age in their home. So we talked about the need to relook at how long-term services and supports are funded, and talked about the importance of home and community-based care. Broadband services, we found, with a pandemic, how important broadband was.
Absolutely.
And so that was something else we discussed, and caregiver and kinship care, grandparents raising grandchildren. It was a nice opportunity to be able to talk to them about those things and then just hear from them what they're working on, which a lot of it is the budget right now. So.
Well, that was perfect, and that takes us right to the end. So thank you so much for covering such important information and giving that update. You can always find out more information about senior resources on our website, seniorresourceswmi.org. You can call our options counselors at 733-3585, or if you can't remember any of that, you can always call 211 and they will connect you to us. Thanks for joining us, and we'll see you next time.